Hi, this is Sarah Rudolph with Vital Life Physical Therapy and Wellness in Longview, Texas. Today I'm going to show you a neural mobility exercise, which is actually a follow-up from the previous one that I did lying on my back. Now this is sometimes known as the slump test, which a practitioner might use to check how much movement somebody has in their nervous tissue or their neural tissue. Know anything about our anatomy? We have our brain up here and then our spinal cord that comes down from the base of our skull all the way down, which is housing, well, the spine is housing our spinal cord, and then the nerves come out into the legs and of course into the arms from up here. So in order to put that on stretch, what you would do is go into a slumped position and then see if you are able to extend your legs. Now, somebody who has had back pain or possibly back surgery or an issue with the mobility of the nerves may not be able to have that full range of motion. And so this is an exercise that is sometimes beneficial to help people get their range of motion back, which can also help to reduce stiffness and pain. I would advise you to do this under the supervision or guidance of your physical therapist, but many times I use these videos to give to patients of mine who I have already taught this exercise to when they come to see me as a client. So what you do for your slump exercise is you sit on a decent surface like maybe a dining chair or a bench, and you put your hands behind your back. And then what you're going to do is actually slump down here in the middle. So kind of where the bottom of your rib cage is, you want to bend there. And that's going to cause a stretch on the spinal cord in your back. And then you're going to actually drop your chin to your chest. And what that's going to do once again is it's going to create a bit of a stretch on the top part here. And then you maintain those two elements. And if you already have a stretch or a discomfort in this position, this will be where you will want to maybe stay. You may not even want to start with the extending of the legs. And in this case, you can do a few movements with just your head and neck, and then with your thorax to mobilize those nerves in those areas of your body. If you are already able to do this, then what you would want to do is extend your leg at the knee to where you feel a bit of a pull in the back of the leg somewhere, or you may even find that extending the knee may cause you to feel a pull up in your back somewhere. Now, you don't want to extend to where you feel pain, but just a pulling or a stretching sensation. And then what you can do is just bend at the knee to decrease the stretch again, and then straighten out the knee to increase the stretch over the knee joint. So we're actually moving that nerve over the knee, stretching, and then releasing the stretch, and stretching, and releasing the stretch. And again, each person, this is going to be different. You may only be able to lift your foot that much, and then you'll need to go back down. So you'll do 10 repetitions like that, once again keeping the slump position with your torso, with your head, and with your hands behind your hips. Once you've done 10 excursions with the knee, you're going to hold it again at that point of pull, which may feel improved after those 10 repetitions. And then you're going to pull the foot back towards you as far as you can, to the point of pull but not pain. And then you're going to flex the foot away from you, keeping the knee at that same angle. And you're going to do 10 repetitions of the point and flex. After you've done your 10, again, you're going to want to hold the foot there. And you may feel a release. And then you can again extend through the neck and upper back and drop down again. And extend and drop down. So once again, what we've done here is we've put a stretch on the nerve over the knee joint and over the ankle joint. And in this position, it's also stretched over the back and the neck. And then we are releasing the stretch. And then increasing the stretch and releasing the stretch. Only do 10 repetitions of each of those movements. And just like I explained in the other exercise, You want to make sure to do this on the side that is not symptomatic. In fact, you may want to do it on that side first because generally that has more mobility. And sometimes even doing it on the good side first may already improve the range of motion on the side where you feel the tightness or the discomfort. So once again, this is the slump exercise for neural glides, or neural flossing as some people know it by. And this one, like I said in the beginning, is generally a progression over the one where you're lying on your back and you lift your leg up in the straight leg raised position. So if you're trying these on your own, I would recommend that you try the one with the straight leg raise first. And then once you can do that one through the full range of motion, you can move on to this slump exercise that I have just gone over. If you have any questions about these, please feel free to follow up with myself through email or through direct message on Facebook, or you can even give me a call. Or if you're not local in the area, feel free to contact a local physical therapist and get their advice about using these exercises for your condition. So I hope this has been helpful to you. Again, my name is Sarah Rudolph with Vital Life Physical Therapy and Wellness in Longview, Texas. Please feel free to reach out to me with any questions, and you can find my contact details below this video.